A sharp, defined, beautiful jawline is all the rage right now. All the celebrities are doing it, and so naturally, all of your patients are going to be requesting it. This is a skill that you could really benefit from having in your practice in order to satisfy all of your patients' wants and needs. You can see here, we are doing this procedure using a cannula. We did use a needle in order to create the pilot hole, but now we are using that entry site to advance our cannula into place. Cannulas tend to be safer than needles, and so in this area where we're dealing with a lot of very important and very large vasculature, it's important that we use a cannula here to be as safe as we possibly can. You can see the injector is repeatedly checking the placement of her cannula. It's important that you know where the tip of your instrument is in order to be as safe as possible. So she's just slowly advancing her cannula every couple of passes, checking to make sure where she is. And then once she gets into place, she's going to aspirate before laying any product there. Aspiration is a safety technique that we use in order to hopefully prevent a vascular event from occurring. You can see here she has aspirated and now she is laying a linear thread of material. So as she is withdrawing, she is filling in a retrograde action. We always want to fill as we are pulling out. And you can see she is going nice and slow, placing a very small amount of product along that jaw. She's using a product called Radiesse, which is a type of filler. It is called calcium hydroxylapatite. So it is different than your typical hyaluronic acid fillers because it is a biostimulatory agent. In addition to providing immediate lift and structure and support, it stimulates the body to produce collagen. It's called neocollagenesis. So in addition to providing that structure and support, we're also going to be rejuvenating our skin. So you get two benefits in one type of filler. With that being said, because this is not a hyaluronic acid filler, we cannot reverse it with hyaluronidase, which is the enzyme that breaks down fillers. So you don't necessarily have that safety net to dissolve the filler in the event of an emergency. Because of that, you do need to be an experienced injector in order to be using this product. You must know your anatomy very well. Again, always knowing where the tip of your cannula is, always aspirating and doing all of these safe injection precautions to hopefully prevent any potential complications. Alrighty, now we're going towards the anterior portion of the jaw, and again, she's just sliding that cannula in, checking her placement every couple of passes, and then once she gets into placement, again, she will aspirate and then lay a small linear thread as she is removing her syringe. You can see here we're just sort of discussing our next move. She's placing her finger below there just to sort of localize that product so it stays just on the angle of the jaw in order to truly give that very sharp definition that we're going for here. So you can see again, just a small amount of product. We've barely used any product here so far. The first part of this syringe was used to define her chin. And so, the beauty of placing filler is the smoothing process afterwards. Smoothing your product into place is really going to give you that most natural effect, and that most natural look is when your product is smoothed into the tissue. We're going to move on to the left side of her jaw, and again, just repeating that same procedure. We're using a very small needle in order to create our entry hole, and now coming in with our cannula and our Radiesse, and we're advancing to the angle of the mandible. She has likely already placed a couple of boluses along the angle of the mandible to help create that very sharp angle, and then you come through with your cannula along the jaw itself to create that really sharp jawline. So again, you can see as she advances, she's at the corner of the mandible, and now she is slowly withdrawing. The patient was numbed for about 15 minutes with a BLT-like topical anesthetic, but you can see she is tolerating it really nicely. That cannula, as long as you're in that proper plane, it should just glide right into place. And then your filler, the Radiesse Plus, has lidocaine in the product. So as you continue to work, the patient will become even more numb. We're going to work towards that anterior portion of the jaw here, and then we're going to be done for this particular patient. Good. You can see she just popped right into that plane. So if you're interested in integrating very advanced injection techniques, then sign up for our level 3 dermal filler course. We will take your filler skills to the next level. By that time, you'll have already had experience with cheeks and advanced lip techniques, and you will be ready to take on that next new skill set, which is chin, jawline, tear trough, temples, you name it, we will teach it to you in our level 3 course. But truly, the jawline is what is being requested so frequently now, and you really should consider adding this to your practice so that you can be that number one injector in your area that keeps those patients coming back time and time and time again. Alrighty, here we go. We're just molding a little bit of product so that there's nice smooth integration into the tissue, and then we'll be wrapping up this procedure.